So let me directly start my presentation on local production of vaccines in South Korea. First, where are we now? I got 3 questions from the host, so I tried to answer those actually 2 questions. The first question. So this is the situational overview of regarding COVID-19 vaccine production in South Korea. So there are ongoing 2 types of production. One, contract manufacturing of authorized products of foreign companies, and the other, small-scale production for clinical trials of South Korean companies' candidates. The ones in blue and bold are public manufacturing facilities, which I will introduce in detail later. And as you can see, SK Bio produces AstraZeneca vaccine and also have contracted with Novavax, the so-called CDMO, but this has not been yet authorized. So 2 other consortia produce Sputnik, but this vaccine has not been authorized in South Korea, so all go to other countries. Samsung Bio produces Moderna vaccine, but only fill and finish. And some of these locally packaged ones have been supplied to Korean people. And the government has never imposed an export ban over any locally produced vaccines. Several local companies are developing their own vaccines, and the most promising one is the SK Bio vaccine, which is under the phase 3 trial. And this one has got investment from SEPI as well as from the South Korean government. I expect neither of them imposed any conditionality over their investment. We do not exactly know about the manufacturing capacity of private companies, especially how they are allocating their capacities between different projects. At least we can say that we have these proven manufacturing capacities of different platforms, either large or small scale, either of drug substance or drug product. Unlike private companies, public manufacturing facilities make public their capacities. Here I show you all the public vaccine manufacturing facilities that are doing either large or small scale production of either foreign or South Korean companies. Note that these are not public pharma, but are CMO facilities. South Korea does not have and has never had public pharma. These facilities are mostly under the Ministry of Industry, established and has been run to support the private pharma. The second is the main challenges of developing vaccine manufacturing in South Korea. So for COVID-19 vaccines, it was important for AstraZeneca, Gamaleya, or Moderna to find manufacturing partners, as they did not have enough capacities and the worldwide demand would be enormous. So some South Korean companies were chosen as their partners. But other than the COVID-19 vaccines, the self-sufficiency rate of vaccines in South Korea has rather low compared with other countries with big pharma. So in 2017, there was a lack of supply of even BCG, DTaP, or IPV vaccines like NIP vaccines. And these led our government to temporarily readjust our NIP vaccination guideline. So it was the year of 2010 that the government set the ambitious goal to increase the self-sufficiency rate of vaccines from 25% to 80% in 10 years. Since then, the government has provided all kinds of financial and non-financial support to the vaccine industry without any conditionality. And the original target of 80% has kept repeatedly readjusted and has not been achieved even until now. So I'd like to present the 2 challenges of developing vaccine manufacturing in South Korea over the past decade. The first one is the private pharma and the private providers. Unlike NIP, the non-designated population and other vaccines prices are not controlled by the government. So note that South Korea has national health insurance system combined with the private dependent provision system and based on the fee-for-service reimbursement. So the private providers are more motivated to prescribe non-NIP vaccines, and the private pharma is more motivated to develop and produce those profitable ones. This is clearly mismatch between the government support and the private motivation, which has led to the stagnant self-sufficiency rate, I guess. And the COVID-19 vaccine case is very unusual, free for all, and procured and distributed by the government. And the second challenge is the IP disputes with the TNC. So I am showing the example of PCV vaccine market, which has been monopolized by Pfizer and GSK. But in South Korea, the market share of Pfizer one has been greater than 90%. And SK Bio actually developed their own PCV vaccine, but was sued by Pfizer and lost. So they cannot sell it by 2026. And this, there expects even more evergreening strategy by Pfizer. At least one good news for SK Bio is that they won the lawsuit regarding their technology transfer to a Russian company. Regarding mRNA type COVID-19 vaccine, the government patent office recently released a report with an analysis that out of 691 relating patents, only 17% has been applied in South Korea, which is lower, way lower, and means less risk than other countries, and very similar with South America. Under this context, it may be very weird to see that the South Korean government does not support the TRIPS waiver. One possible explanation, I think, is its ambition to become a global vaccine hub with the support from the US government and the US companies. So this picture is back to last May when our president visited the US to sign a contract with US government for Cora's vaccine partnership. So the government, our government may be trying to gain trust as a site for sub-licensing of patented products, and also be trying to protect our local development and manufacturing as well without the TRIPS waiver.